Hey, it's your girl Marquita Beyond, the host of the Pink Link, where we have powerful, innovative, next level conversations with that K, because we fancy y'all. And I'm just excited to be here today, honey, because we're looking forward to doing lunch with you all and just doing our thing with entrepreneurs in the community, doing desserts that we redefine that have you fine and geared to shine mentally, physically, and spiritually. Now, with that being said, some days you may get too stuffed, but you're still leave full of purpose. So, what we usually do to start the show off is our wisdom wiser, which will leave you a little bit more wiser. That's our appetizer. So, the one that I have this week is from Bishop Bronner. You all know I like to share his his quotes and things like that he gives to us, supports to us. So I want to pour into you all. So, the one that stood out to me on yesterday was anyone that is close enough to help you is also close enough to hurt you. So when he said that, I was like, wow, that's just so profound because, like they say, keep your friends close and your enemies closer. So I do have a guest, you all, and I want to get her take on that wisdom wiser for today. And I have with me Nurse Rosalind.
Hi, everybody. How you doing today?
Hey, girl. So what is your take on that?
I definitely can agree with that. I feel as though you always, you try to trust people, right? But in the back of your mind, you have to be aware that not everybody has the same intentions that you do.
Oh, I
Yes.
love that.
Yes.
I love that. So, though you and you don't make them you. You
Right.
can't think everybody's a you.
Yeah.
So that's what I've gotten at a lot
Yes.
because I'm like, just because I'm this way, don't mean they're this way. So you have to accept people for who they are.
Exactly.
Be watchful. So, you got to be mindful who you let close and who you let into your circle. We would say. So y'all, Miss Nurse Rosalind, she's from go back. Wiser Medical Services Clinic.
Yes.
So yes, it's definitely amazing to have you today.
Thank you for having us.
Yes. So tell me more about you. How long have you been in nursing first?
So I initially started off as a registered nurse in 2016. And then I went back to school and got my nurse practitioner degree in 2021. So I've been a nurse practitioner going on three and a half years.
Oh, wow.
And I've been in the West End community for just about that long.
Okay, well,
Yes.
congratulations
Thank
to
you.
that. And girl, your girl love the West End because I be on there all the time,
Yes.
That's why we get my vegan eats and treats and sweets, girl. So
the good food.
yes,
Good food.
yes. Wadada, so veg, all y'all. Hey y'all. So, how long has Wiser Medical Center been around, and who founded that center?
So Wiser Medical was founded on June 1st of 2023, so last year. So we just made a year this summer. And it was founded by Delano Francis, who is the owner. Okay. And then, so we're a primary care clinic down in the West End in Ralph David Abernathy Boulevard.
Okay.
Yes.
Okay, I'm trying to see have I seen it before. I may have. Right, I'll be over there, like I said. So I may have seen that road right past it. So that's good to know. So you all are a primary care clinic.
Yes.
So why would one want to make sure that they have a primary care doctor, especially within the Black community?
Before I answer that question, let me go back and just mention that the physicians there are Dr. Betty Elizabeth Strong. She's been a MD for over 30 years.
Oh,
so she's been doing this a long time. And then, of course, myself, Rosalind Primus, the nurse practitioner. And then, I'm sorry, go ahead with your next question.
Okay, well, shout out to all you all over at Wiser Medical.
Yes.
Thank you for serving the community and, doing what you do and doing it with purpose, I would say.
Yes.
So that's great to hear, especially 30 years in the game.
30 years.
30 years. Congratulations. Yes. I mean, like, whoa. But that's another thing I want to just ask was the question of why should one make sure that they have a primary care doctor, especially within the Black community?
So having a primary care doctor is important because as a primary care doctor, we are there to screen patients for diseases, especially chronic diseases, And then once you do have a primary care doctor, we're able to help treat those diseases. And it also, when you have a primary care doctor, you see them a lot more. So you establish a trust and a bond with them.
Okay, that's great. So you said you all screening for like chronic diseases. What are some of the chronic diseases that are plaguing the community right now? What you say?
So some of the chronic diseases are hypertension, which is high blood pressure, diabetes, that's a big one in the Black community, unfortunately.
Yes.
And a lot of times, patients don't know that they have diabetes because they don't go to the doctor, right? Sometimes they'll eat all these things and um, not exercise. And then, when they finally do go to the doctor, their A1C level, which is their diabetic level, is over a 10. And at that point, they may need to go on insulin.
When you say over a 10, because I'm kind of foreign to now my family have diabetes, but I'm foreign to
Right.
over a 10 because I thought it would be like 900 numbers and things like that. So what's the difference between over a 10
Yeah.
and then a triple digit number with diabetes?
So a normal A1C level would be below a 5.7, right?
Oh, okay.
Yeah, so it's based off of
When being tested.
Right. Based off of numbers. And then when you get to 5.7 to 6.4, that's pre-diabetes. So pre-diabetes is warning you, like, hey, if you don't make some lifestyle changes, you're going to become a diabetic. And then 6.5 and above is type 2 diabetes.
Wow,
Yes.
I'm glad you said that because now I just want to go back to when I went to the doctor some years back, and I think I was close with those numbers
Yes.
to being a pre-diabetic.
Yes.
So they could see that on that scale. So
Yes.
I guess if I was like, if it's 5 point something, I maybe was like at 4.8 or something.
Right.
If I didn't get my life together,
Right.
I could have went into pre-diabetic, but if I wasn't going to the primary care,
Right.
I wouldn't have known that and could have easily went on into diabetic full stage if I just let years went by without seeing a primary care doctor.
Right.
Oh, I'm glad we're having this conversation.
Yes, I know. It's an important conversation to have. For
Wow.
sure.
So, you all, I hope you all are getting, some good news that we are just sharing about just primary care right now. So we're gonna take a quick break and we're gonna come back and get back into it with some more. We all hit 92.3 ACS. It's your girl Marquita Beyond the Pink Link. Why one should have a primary care clinic, and the importance of just early diagnosis to, be preventive in your healthcare measures, right?
Yes.
So we just talking about that today, and I hope, what we're discussing can definitely help you, whether you have a primary care doctor or whether you're trying to find one, especially maybe you may consider, even going there and checking them out at the same time. So I want to get into also like healthcare for the elderly, and things that they experience and things like that. Being I have worked in healthcare field with, those who may have struggled with Alzheimer's, dementia, and things like that. So is there a way that they can be like screened early for dementia and Alzheimer's and things like that?
Yes, there is a way they can be screened for Alzheimer's and dementia. Typically, we start the screening process at the age of 65 and up. But if they do have any symptoms of like forgetfulness, we'll start screening sooner. So the screening consists of some providers do a mini mental state exam. So it's just a bunch of questions the patient fills out or that we'll ask the patient, or a 6-CIT test as well. So once we do that test, then we get the score. If it's abnormal, then we do other steps. So one step that we like to do would be doing a U method blood test. So the U method blood test is available through Quest Diagnostics, and I believe Path Group does it as well. So what it does is it takes your blood and then it'll provide a report based on what could be causing the Alzheimer's markers inside of your body, like vitamins and that sort of thing, vitamin deficiency and that sort of thing. So I do think it's important to definitely screen for Alzheimer's so you can catch it early on.
Wow, I love that you say that too. Just the steps that you all take to
Right.
help try to offset early stage of Alzheimer's
Yes.
diseases. And so when you mentioned the vitamin deficiencies, that is so critical. Whether you being tested for Alzheimer's or not. During COVID, many people passed from lack of vitamin D.
Yes,
So,
yes.
even myself as a vegan, that's something that I literally go to. Like, thank God I'm healed. Feeling great. But a lot of times I have to definitely make sure I set appointments to just go get my vitamins level checked.
Yes.
Vitamin A, vitamin D, vitamin iron, all those things to make sure that I'm getting the nutrients that I need on my diet.
And as African Americans, our vitamin D levels tend to be a lot lower than other races. So when you do go see your doctor, make sure they're testing your vitamin D level. Because sometimes that could be why you're feeling so tired.
Exactly.
Yes. Get your vitamin levels checked.
Test it unless you request it.
Exactly.
Because I requested every time.
Yes, you gotta fight for it, unfortunately.
Could you check out my vitamins? And he's like, we don't see what you get. Everything you can check,
right.
Please.
Yes.
So, girl, we're gonna take an icebreaker moment, and y'all know if you listen to the Pink Link, we like to do the joke of the day, and so that could be like cringy or corny as my kids call it. So, who cares? Because we're gonna do it anyway. So, the joke of the day today, I have what did the banana say to the nurse? Since you're a nurse, Nurse Rosalind, do you know?
The banana say to the nurse. No, what did they say?
I'm here to see the doctor. I am not peeling well.
Not peeling well.
Yeah.
That's cute. That's cute though. Know, that's right? Cute. I like that.
Get a nurse.
That's cute. I love that.
I try to, be creative. Like, I've been working, if you don't see. Like, that just didn't fall out of nowhere, y'all. I have to go find it. Okay, so now we're going to get into the next question. Okay. So, when it comes to overall health, how much does diet and exercise plays a part in differential yeah, Lord, that should have been a word. And differences from your family genetics, like how does that play a part compared to your family genetics?
So your genetics you can't help, right? Because you're born with it, right? But your lifestyle, like your diet and exercise, that's something you can help because that's something you can do, right? So it's very important that patients are incorporating a healthy diet and exercise into their lifestyle. Because if you already have a family history of high blood pressure, high cholesterol, and you're just sitting around eating whatever you want to eat and not exercising, that's not going to help.
Exactly.
Yes.
I love that because personally, I don't prefer when doctors ask me my family history. I know they have to know it,
right?
But I'm like, you're not gonna just try to diagnose me because what my mom had or what my sister had. Because my mom passed from cancer, my sister passed from a heart attack, and then my family's on both sides have high blood pressure, diabetes, and things like that.
Right.
However, with me knowing these things consciously, I'm vegan, I'm plant-based, nobody else is, I'm exercising, and thank God I don't, have to deal with those. Now, I've had high blood pressure years ago, but by me being just proactive and not just, I'm going to take the pill to solve it, I chose to, eat better to help me overcome that diagnosis of high blood pressure. So I know for me how important it is, and so I just wanted to get your take on it so that they can see that even my own people, they be like, well, I'm going to stick myself and eat this cake, but you can do things outside of the medicine that you're prescribed as well.
Right, and I always tell my patients that I'm not a provider, neither is Dr. Strong, that likes to just stick you with all these medications. I like to do lifestyle intervention like diet and exercise first before we get to the medication. Right. Now, if I feel like you really need it, then I'll tell you. But some things can be fixed with just lifestyle intervention.
Right. And I get that too, like, because I'm also an advocate for like holistic health.
Yes.
But if I just need something then to help me get across the hump, baby, I'm gonna do it too.
Right.
So definitely I always just take, the advice of your provider, but do your own research and know that it takes you to make sure you're doing what you got to do to get better. Don't just leave it into your provider's hands. So that's what I've learned just on a health journey is being proactive. I would like to also know, like, what specialists do y'all have at Weiser Medical Center? your clients and patients?
So we don't have particular specialists there at Weiser, but we do refer patients to specialists outside of Weiser, whether that be cardiologist, neurology, kidney doctor, heart doctor, so on. But as far as things that we do at Weiser, we do have allergy testing. So we have an allergy tech come in once a week to test patients for allergies and give allergy immunotherapy, which is allergy shots.
Okay, I'm glad you mentioned that because I was just talking about this weekend. Because one of my friends, she's allergic to gluten.
Mm-hmm.
So she try to make sure she's not eating anything with gluten in it, which is wheat. So I'm like, now I had that test and I felt like I had like a sensitivity to gluten, but they said I was good. But it's like, I don't like how I feel when I eat gluten.
Right.
So your body also tells you, right? So though I may not be allergic to gluten, I could have a sensitivity to it.
You can have an intolerance and sensitivity to it for sure. Yes.
So that's what I come up with. I'm like, well, maybe I have some type of something to it because I don't like how it makes me feel.
Right.
So I try to stray more away from it as well.
So the allergy is showing in a different way. So it's not like a rash or anything like that, but it's.
Well, I think when she eats it, like her throat clogs up or something. Oh, wow. Girl, very informative. I'm enjoying this conversation.
Yes,
I hope you all are too. And, taking some notes, and things like that. So, to move on to the next question I have for you, autoimmune diseases. So, I'm seeing like so many, just like everywhere where you look, it's an autoimmune disease. So, what is your take on that, and what would you, say, maybe causing those things?
So,
and when we say autoimmune, you could go over certain ones of this or whatever you feel.
So we'll just do lupus, right?
Right.
So that's a common one, right? So if you have symptoms of lupus, I always recommend. Well, your primary care doctor should be testing your CBC level. So that's your blood count level. So if that's a little bit off, then that should trigger your primary care doctor to look more into it, right? And then they're supposed to order a rheumatology panel. So that rheumatology panel should show that you have a ANA marker, which will in turn it'll either come back positive or negative. If it's positive, then that's when I would refer to an actual rheumatologist for the patient.
Okay.
Yes.
Okay. So with that, like there's no cure. So is diet like something that help alongside? Because I've seen things where people say where they cured certain things just from their lifestyle and diet, and others who didn't have that same thing. So what would you say like to that?
I think everybody's different. I can't say one person is wrong versus the next. But what I can say is when you have autoimmune disease, it's important that you have a doctor, right? Mm-hmm. Whether you agree with taking medication or not, just have a doctor so they could just say, hey, this is how you're doing right now. How are you feeling? This, that, and so forth. But yeah.
Right. Because I have a friend, and she stuck with it. So I know how important it is because, like I be hating when she be going through her little battles with it.
The flare-ups.
Flare. So it definitely affect, her, it can affect her whole day and things like that.
Right.
So yeah. So y'all, we're gonna take another quick break and we'll be right back. It's your girl Marquita Vian on Hit 92.3 ATL. Okay, so we're back. Your girl Marquita Vian on Hit 92.3 ATL, the Pink Link Show, and we're here with Nurse Rosalind from Weiser Medical Clinic. So we've been just discussing, primary care and things like that, and being preventive, with your health care and things like that, making sure you have a primary care doctor. So, with that, I want to just ask you this as well. How important is it for men and women to get their yearly screenings, physicals, mammograms, bone density scans, colonoscopies, and if possible, could you just give me a brief description of either one?
Okay, so it's very important that patients are getting their annual wellness physical exam. Screenings save thousands of lives per year because they're able to catch chronic diseases and or possibly cancer before they further and progress. So that's very important. And then you wanted me to name one of the
Yes, like what would that process look?
So let's say colonoscopy. There's different types of screening for colon you can do. There's an actual colonoscopy where you are put under, and then they're able to screen your colon that way. And then you can also do a stool test and send it. So we like to use Cologuard. That's the company name.
Okay.
And then they'll send a kit to your house, and then you put a stool sample in there, and then mail it back, and then that can also detect for colon cancer.
Oh wow.
Right. And anybody over the age of 50 years
So-
old should be getting their colon screened.
Wow, so they don't have to go inside to the doctor with the the grueling process. They can just
Right. There's other ways. Now, the
That's
colonoscopy is the most recommended way to do it, but there's other options.
right, because I know
Yes.
a lot of and this gonna lead to the next question. A lot of men don't like to go up in there to have nobody sticking that up them, right?
Right, right.
That's the process, and we can just
Right.
state that. So, why do you think men are less likely to go to the doctor over women?
I think that one is fear of being told that something is wrong. I think sometimes men have a hard time with that. And then masculinity, right? So they may feel like they're weak if a provider's saying you have this wrong with you. And they're used to being so strong, right? And then another reason is the discomfort of exams. So like prostate checks, testicular checks, colon cancer screening checks, that sort of thing.
I'm not gonna downplay it, but do y'all know what we go through?
Exactly. I tell you,
It's not fun either.
It's not fun.
Okay, so y'all just get a little. I don't know. I can't say. I'm not gonna downplay it, but honey, we don't like going either. Okay, so y'all, we're gonna take a word of the day moment. And the word is I know somebody that guessed it already. Demure.
Demure.
Yes, and so I'm gonna get a definition, and I'm gonna let Nurse Rosalind use it in a sentence. So
Boy.
the definition of demure, because many were like, okay, what does it mean?
Right.
I'm
There's so
hearing
many
it in the
different
streets.
ways it's being said.
Right, like somebody using it wrong because it can't mean all these different things. Like you
Right.
know how y'all referencing it out there. So it means reserved, modest, and shy. Typically used of a woman, a demure young lady. Is the definition that I found per Google source, y'all. So Nurse Rosalind, use demure in a sentence, girl.
Okay. Let's see. So the doctor's smile was very demure, which made the patient feel more comfortable.
Oh, cool. I like how you did that. Like, we been thinking about our doctor. That's what we talking about.
Right.
Okay.
Try to bring it back.
Well, y'all, usually I say it's a new word. Go out there and use it. But hey, I'm pretty sure you about to use it, so use it again. Share.
I see that word every day.
Right,
Yes.
share the definition of it. Maybe
Right.
you can inform them. Do y'all know what the word mean? And tell them you got it from the pink link. So now we're gonna get back to the topic at hand, and it's just some more questions before we wrap it up with Nurse Rosalind. So I want to just ask, when a person may have high blood pressure, stroke, or struggling with sleep apnea, how would you recommend them to just start a healing process? With those type of big diagnoses, because I literally have my kid's aunt passed away. She succumbed to her stroke that she had 6 years ago.
Right.
She never recovered. So is it a possibility that you can? Some do recover, but for that length of time.
So with stroke, some recover, 100%, but there's some that have deficits, residual deficits, what we call it. So their strength is not what it used to be. Is she in physical therapy, I would hope?
She passed yesterday.
I'm so sorry.
After about 6 years of having a
6 years, yeah. So I recommend anybody that does have, did have a stroke, they definitely get started with physical therapy. Make sure they're seeing their primary care doctor, their neurologist, as well.
Right, yeah, girl. And sleep apnea. So I know when I went to get my test for my CDL,
Yes.
they was like, they look at your neck. So what does the neck? Because he can go into it, but I'm like, why my neck gonna let you know how I'm sleeping?
Right. So your neck circumference, they're measuring your neck circumference. So if it's over a certain amount of inches, uh, think about it. When you're laying down, right, your
Oh,
airway.
yeah.
So sleep apnea is all about your airway, right? So if it's not getting, if enough, not enough air is coming through, then that air is not going to your brain, right? And that causes you to stop breathing. So
Okay.
that's why it's important. If you notice that you're snoring a lot or you just feel tired throughout the day, you sleep out of nowhere throughout the day, make sure you talk to your doctor about that so they can get you a sleep study done.
Oh, wow. Okay, that's informative.
Yes.
Yeah, so let me ask you all. So, do y'all have like any programs for transportation for those who may need to see a doctor but don't have, the means to get an Uber or need ways to get there?
So some insurance companies do have transportation services. So I always tell patients make sure you call your insurance company to see if that's an option. Uh, but I do know that any patient that has state Medicaid in the state of Georgia, they're entitled to free transportation through Verida Transportation, and a lot of our patients do use that service.
Okay, great.
Yes.
Deal. Okay, so what are you all working on for like any health cares and things like that for the community to be able to participate in at Wiser Medical Center?
Yes, we've done. So we're working on doing some more health fairs. We've done about 2 or 3 this year that were pretty successful. We like giving back to the community and letting the community know that we're here for them. So that's what we have coming next.
Oh, wow. So when we say healthcare, like, is it like different doctors, different, insurance companies that will be there, or how does it look for one that haven't maybe been to a health fair?
So usually at health fairs, you'll see all type of different services offered. So yeah, it could be pharmacies, it could be any labs, it can be other doctors out there, but we all try to give back and help the community.
Okay, I love it. I love it. I love it. So if someone wants to find out more information just surrounding health or around health, or ways to just start their journey towards being a better, them for their health, mentally, physically, what is there something that you would recommend personally to them, or a book or something that you've turned to for yourself?
So if they're interested in learning more about, their health, I would recommend checking out. There's the CDC. Believe it or not, the CDC has a lot of information on chronic diseases and healthy plans and diet.
Okay.
Yes.
So you can go do the CDC or
Right. Through the CDC website. Yes.
oh, okay. So that's great. Okay. And so, y'all, we're gonna take a quick break and we'll be right back. It's your girl, Harper the Piano, hit 72.3 ATL. And we're back on hit 72.3 ATL, and we've been here today with Nurse Rosalind from Wiser Medical Clinic, and she's just been just giving us the scoop on healthcare, being preventive, and having a primary care doctor. So I hope you all have definitely enjoyed the conversation. I thank you all for listening. I thank you, Nurse Rosalind, for coming on. So you gotta tell the people how to just, link up with Wiser Medical Clinic.
So we have a website. You can reach us at wisermedicalcenter.com. Wiser is spelled WISER. And you can also give us a call to book an appointment if you're interested at 404-346-3487.
Okay, girl. Well, I thank you, and definitely y'all tap in with them, and whether you're tapping in with them or whatever, just making sure you being proactive and being taking preventative measures for your health and well being. So I definitely enjoyed y'all, and I'm glad to be back. It's the Pink Link on his 92.3 ATL. Bye. 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 Yeah, bye.